There we go. Thanks. Well, good morning, everyone. I want to get started on time. We have quite a number of more people joining us, but we are recording this session, so we will we'll go ahead and get started, and we'll invite people that are joining us fresh to catch up with us over the recording. Want to welcome you all back. This is a series of free webinars that we're doing that we call our COVID Rapid Response Series. Around issues that are timely to helping nonprofits navigate the pandemic and all of the issues that have come around it. And as a result of it, we're happy that you could all join us today. We have about, I don't know, 150 of you registered, and we know a lot more people also listen to the recording. So however you're joining us today, welcome and thanks for connecting with us. As always, we want to be a resource to nonprofits all across our state as you continue to figure out what's next. And what's next right now is lots of questions around vaccines. And so this is a session devoted to that conversation, not to convince you, but to get a vaccine, but instead to share with you the science of vaccine and also to answer your questions around employment and your workplaces and all of the complexities of running and leading and guiding a nonprofit through this conversation. So we have three wonderful guests with us today. And just excited to help us dive in. The way that we'll navigate our time today is that we'll first hear around the science of vaccine with Dr. Rabinowitz will be with us, and potentially also Dr. McLaughlin will be with us as well. And then we'll take questions around the science component of the vaccine and kind of the state of Alaska perspective in that space. And then we will turn into our senior director of HR, Rebecca Cevedas at 4Acre, will provide us some context and some frameworks around employment and writing policy and process and framework and all of those pieces. And we're also joined by 4Acre attorney Steve Mahoney, who will also help us navigate the legal complexities of these conversations. So we have an awesome group of people today with you to help answer your questions. We did ask for questions in advance. No fear, if you did not give us those questions in advance, we will do our best to get to your questions today. We are monitoring the chat bar. Just again, you are all on mute because there are so many of you. So we're going to just ask that you use the chat bar to post your questions. If you send us a question in advance, we have it, and we have it in the queue already, and we'll work from there. If we run out of time for some reason, then we will follow up with you and make sure that you get your questions answered. So feel free to just use that chat bar to navigate your questions. A shout out to the 4Acre board members who are on the call. Thank you for all of your leadership, and also our 4Acre, we have many 4Acre staff and consultants on our call as well, so shout out to them. Thank you all for being here as we all together are navigating the sector. I'll also just do a quick plug that tomorrow we're having another session, another one of our rapid relief sessions will be on the launch of a website to track the new federal relief funding coming through Alaska. So if you're interested in that conversation, that is happening tomorrow. We'll say more about that at the end of our time today. All right, well, let's dive in. So I am joined, or we are all joined by Dr. Rabinowitz is with us today. We're grateful to her. We were, as many of you know, Dr. Zink was going to be with us and she got called away, but we are so fortunate that Dr. Rabinowitz could jump in and help us all out. So Dr. Rabinowitz was born and raised in Alaska and has been practicing emergency medicine at Providence Hospital in Anchorage for over 18 years. She is a staff physician with the State of Alaska Department of Health and Social Services COVID-19 Task Force. She is passionate about the health and well-being of all Alaskans with a focus on vaccine education and engagement. So perfect timing, Dr. Rabinowitz. Thank you for joining us today. I'm so grateful that you could be with us. We're gonna, Dr. Rabinowitz has a presentation to share with us. So we'll listen to that presentation all together, and then at the end, we'll take questions. So with that, Dr. Rabinowitz, welcome. Thank you so much for joining us, and the stage is yours.
Excellent. Thank you for that kind welcome. And yes, Dr. Zink sends her apologies. She had another engagement that she had to jump over to. So Dr. McLaughlin, our state epidemiologist, is going to try to join us as well in this first half hour.
And he is here. I can
Perfect.
see.
Hi everyone. I'm
Thank
here.
you.
I'll be here for a half hour. So thanks.
Okay,
excellent.
welcome.
And we just wanted to thank Foraker Group for all the work you've done, keeping us all connected and engaged and educated throughout this. And then all of the nonprofits throughout Alaska that have worked tirelessly through this pandemic for our most vulnerable populations. Everything from food and housing insecurity, mental health issues, logistics, healthcare, and then just we can't forget the arts and all the, quilting groups that kept us connected this year. And this year's been challenging for everyone. The nonprofits have had to keep themselves viable and safe while still providing the safety net for our state. I think the biggest gift we've been given is the increased communication and collaboration across the state. And I've seen, especially in healthcare in the nonprofit world, a lot of streamlining where we're now working together even more fabulously. So I think that will serve us moving forward in health equity as we kind of tackle these issues as they come up. So we're going to move on to our slide presentation, and we're just going to do a quick review of kind of where vaccines are at. And then we'll open it up to Q&A, figure out what we can answer and support you as we go forward. So these vaccines are extremely effective, even more than we could have imagined, especially against severe disease, hospitalizations, and death. And so we feel very confident, putting that out there. We feel very good that we have this available, and this is how we treat viruses. They're also extremely safe, and we'll talk about that in a minute, but we have one of the most robust safety monitoring systems in the world. And we've seen it work well, especially with the Johnson & Johnson pause that occurred the last few weeks. And really what we're working towards is this community protection, and that's how we're going to move forward out of this pandemic. So most of you know this, but we now have everyone that lives or works in Alaska 12 years and older eligible. And on June 1st, anyone who travels to Alaska will also be eligible. Pfizer and Moderna are our mRNA vaccines. Those are 2 doses. Pfizer's 12 years and older, 21 days apart. Moderna 18 and older, 28 days apart. And then the Johnson & Johnson Janssen vaccine is 18 years and older, and it's the 1-dose shot. So these vaccines are very safe. We get asked a lot, were steps skipped? How did this happen so quickly? And no steps were skipped. All of these FDA approved vaccines in the US have gone through all the phases of clinical trial. We're now in phase 4, that's that post-marketing, where we have hundreds of millions of doses out there. And we have seen a safety concern pop up with the Johnson & Johnson, which reassures Dr. McLaughlin and I that our systems are working, they're in place. They did happen quickly, and these are for the main reasons. So with the MERS and SARS viruses, we had all the machinery in place for these mRNA vaccines. They're really the vaccines of the future. So everything was ready to go when this COVID popped up. The US and many other governments have also invested a ton of money with the drug companies and with research and development. Usually with clinical trials, it takes months to years to fully enroll to get participants in these trials. We saw with the vaccine trials that they got enrolled so quickly that they were able to move forward in this. Interestingly, for the first time, they started manufacturing the vaccines while the safety and efficacy studies were ongoing. So if they were deemed to be safe and effective, they had vaccines ready to ship out. I think it's important to note that there were vaccines that were not efficacious enough, and they did not move forward with their vaccines. So this is important to us. We're going to talk about safety quite a bit, but 272 million doses now given in the US. And that's a lot of safety data, more than any other medication that we give every year. And 40% of all of Alaskans have now received at least one dose of the COVID vaccine. As you know, we're making a big push to get our vaccine rates up across the state. On the bottom is our VAERS, that's our adverse reporting system. So any adverse event that occurs around the time of vaccination that gets reported, anyone can report that in. All of those get investigated. So as an emergency doctor, I've made reports around an allergic reaction. The next morning, a doctor from the CDC called me. This system works, and that's how the Johnson & Johnson rare blood clots were found and addressed. The vSafe is a self-reporting app. So after you get vaccinated, you input your own symptoms on that. This will become important in a minute when we talk about pregnancy. And then the CISA on the right is an oversight committee that can also give healthcare related insight, especially around allergic reactions, and they've been very helpful with that. We talked a little bit about allergic reactions. It's important to note that these do occur. Some of the first few allergic reactions with our mRNA vaccines occurred in Alaska, down in Juneau and Southeast, and the whole system kind of changed after that. Again, they're very rare, 2 to 5 per million, and very treatable, but they are significant, and we need to be aware of them. So now all the vaccinators are well trained on identifying allergic reactions. All of the sites have EpiPen or epinephrine available if needed. And then the observation period, if you don't have an allergic history, you'll get watched for 15 minutes. But if you do have an allergic history, we'll watch you for 30 minutes. People have been hospitalized after anaphylaxis or allergic reactions. All of these people have been discharged home. No deaths have occurred. No long-term effects from that. It's treatable, but we just need to identify it. So these are the general side effects, and most of you that have been vaccinated can give your own kind of version of the mix and match that you had. Most people have symptoms for, I usually say 1 to 3 days, and you can get pain, swelling, and redness at your vaccination site. With Moderna, we see about a week later, people will have a return of those same symptoms, so pain and swelling at that injection site. You can also get some more generalized symptoms, so swelling, fatigue or feeling tired, headaches, chills, muscle pains, fever, nausea. And we recommend Tylenol or ibuprofen if people do get those symptoms. Some of the hesitancy around vaccines is kind of worrying about these general side effects. So I encourage people to kind of share their experience with others and let them know how you felt. This is kind of the slide to remind us that we're getting there, we're not there yet. So vaccines are definitely our way out of this, but these mitigation efforts that have gotten us this far, washing our hands, social distancing, masking, are still important. And we still have vulnerable populations and a large swath of our pediatric population that's not eligible to be vaccinated yet. We saw the CDC relax their mask guidance this last week, which was encouraging. The rollout was a little bit clumsy, but I think the bottom line is we know that the vaccines work, and that's why they were able to relax this guidance. And I think everyone will need to kind of assess their personal risk in their community, in their family, and decide on masking from there. So you're considered fully vaccinated 2 weeks after your second dose of the mRNA vaccines, or 2 weeks after your Johnson & Johnson Janssen. And that's when you can start kind of relaxing your mask guidelines, considering yourself fully vaccinated. So you're not Superman the day after you get your vaccine. You still need to give it 2 weeks. And even after 2 weeks, it continues to increase in efficacy. This is kind of Dr. McLaughlin's side, so I'm going to kick it over to him because there's some great points on this slide.
Oh, sure. Excellent. Yeah, I can talk through. I have my top 12 list. What do we have here? About 10, something like that. Okay. So we know that these vaccines are highly effective at preventing cases. You know, the mRNA vaccines, depending on which study you're looking at, it's anywhere from 95% seems to be about the average. Some studies show a little bit higher percentage efficacy, some a little bit lower in sort of the natural sort of environment, if you will, like low 90s, but it's somewhere in there for effectiveness at actually preventing COVID illness. and probably low 90s in terms of percent effectiveness at preventing SARS-CoV-2 infection. And then with hospitalizations and deaths, we see even higher protection, probably in the high 90% range. For the Johnson & Johnson vaccine, it's a little bit lower on all those indicators, infection as well as COVID illness, but higher with the hospitalization and deaths, probably in the high 80s to 90% range for those. If you don't get COVID, you're not going to get long COVID. And this is one of the things that really is concerning all of us. Is it seems like every week there are new reports that are coming out about long COVID, the long-term effects of COVID infection. Early on, we were seeing lots of long COVID among people who are hospitalized. But now we're seeing that it's not just among hospitalized people. People who even have mild to moderate illness can have long COVID effects that can be quite debilitating. In some cases, things like chronic fatigue syndrome can happen. There was a study that was just published a couple of weeks ago in the Journal of the American Medical Association that looked at increased risk of stroke in young, healthy men under 50 who were infected with the SARS-CoV-2 virus, but didn't have any symptomatic COVID illness. So asymptomatic infections potentially putting younger adults at increased risk for stroke. But if you don't get COVID, if you don't get SARS-CoV-2 infection, you're not going to get these long-term consequences. So that's another big reason to get vaccinated. Also, prevention of multi-inflammatory syndrome in children, or MIS-C. This is a phenomenon that occurs in children often with asymptomatic infection or even mild infection. The infection goes away, and then a month or so later, they wind up developing inflammation of many different tissues and organs in the body, and it can be quite scary. It's not common, but it does happen, and we have had MIS-C cases in Alaska. More robust immunity than through natural infection. So if you have a natural infection, you're going to most people will mount an immune response that's fairly robust. And then that immune response, the antibody levels will wane over time. Right now, CDC says if you've been infected, you're good for about 90 days. In other words, you don't need to quarantine if you come into close contact with somebody for 90 days after your original infection. But after 90 days, they want you to start quarantining again if you come into close contact with people. Whereas the peak amplitude, if you will, of the immune response after vaccination is typically higher than from natural infection, unless you have a really severe case and you're hospitalized. And we see that the immune response is the highest among people who've had like ICU stays if they've been infected. But for most people, you'll get sort of an immune response that, let's just say it's about this high. If you get the vaccine, it's going to be higher. And the durability of immunity appears to be much longer for vaccination. Right now, we don't have an end date on if you've been vaccinated, when you need to start quarantining again if you come into close contact with confirmed cases. The studies have gone out so far 6 months and show really strong immune response 6 months out. We're hoping that lasts at least a year. And I just saw in the paper this morning, Dr. Fauci mentioned, I guess earlier today, that he expects that there will likely be booster doses recommended a year out. But again, we'll just have to follow the science on that and see. But in general, you do get a more robust immune response through vaccination than you do through natural infection. The next one on this list is no need to quarantine or test if you are exposed to COVID-19. We talked about that. The vaccine is free, zero cost for that. But if you get COVID, it can be costly. There was a study that came out looking at ER or hospitalizations and ICU stays among COVID patients. And this is the lower 48, and it was an average, but the average cost was about $10,000 for hospitalization and about $40,000 for an ICU stay. And that doesn't include like ER visits. Those can be very costly, or even primary care visits. Whereas the vaccine is free. So for some people, economics is the primary driver. And so that's an important thing to keep in mind. you can travel without testing, and that's true for domestic travel. For international travel, you do have to test before coming back into the country. But this is a big benefit for folks traveling to the lower 48. And then no more masks. And actually now we're saying, most settings, if you're fully vaccinated, you do not need to wear masks. Of course, everybody's aware of that new CDC guidance that just came out this last week. And so certainly we can chat a little bit more. I'm sure folks have questions about what are the circumstances under which, if I'm fully vaccinated, I should still probably mask, and we can talk about that. But these are just some of the big benefits, and there are many more. I'm happy to go through it further if folks have questions on that. Back to you, Lisa.
Thanks. So we're going to spend a few minutes kind of talking about pregnancy and breastfeeding, because this is one of the most important decisions that women and families kind of are making around vaccines. I think it's important to note that in the initial clinical trials, children and pregnant women were excluded. That's pretty common. They wait to do those in the kind of second tier studies. However, there were many women that did go on to get pregnant during those trials. So we do have some handful of data from that. And then now we kind of talked about that VSafe app. We have over 110,000 women that were pregnant, chose to get vaccinated. And there have been no new safety concerns for those women. The CDC kind of did a deep dive on the first 35,000. And again, no increase in adverse events above the baseline for those women. It's really important to note that being pregnant and developing COVID infection is a high risk scenario. So we know that women, if they're pregnant and get infected, have higher risk of hospitalization, ICU, being on a ventilator, and even death. And then for the pregnancy, there's also risk in terms of preterm labor, increased infections, ICU stays after birth, and even death. So it is a significant risk. We now have lots of new data coming out that have prompted the CDC, the World Health Organization, all the major OBGYN and fertility societies to say, look, we see no theoretical risk to these vaccines for pregnant women. We actually think they should be offered and encouraged for women if they feel that it's the right choice for them. We still recommend shared decision-making. So speaking with your trusted OB health professional if you have further questions or concerns, but that's not necessary to get vaccinated. So I think we have a lot of new data out there. Probably the most exciting thing for Dr. McLaughlin and I as we talk about vaccines is that we now know that pregnant women that choose to get vaccinated, when their babies are born, we see protective antibodies in the newborn and also in the breast milk. So that gives you two ways to protect your newborn. When babies are first born, their immune system is very immature and they're kind of reliant on mom for that immune boost, and especially for respiratory viruses. So it's even more important for that. And again, if there's more questions around pregnancy, we can tackle that in the Q&A. This is what we're really going for. Yes, vaccines protect the individual, and especially in our young, healthy population that think, hey, it doesn't affect us as much. We really want to protect the whole community, and that's what we're going for. And especially with variants circulating now, it's really important that we work on that. Dr. McLaughlin gets asked all the time, what's the magic number? What's that herd immunity percentage that we need? And we just don't know. It depends on so many factors and the variants circulating, but we do know that we at least want to get 70 to 80+%. So we have a ways to go in Alaska. There are a few communities that are doing an amazing job, but overall we have a ways to go. And we need to keep in mind there's still that pediatric population that factors into that number that still is not eligible to be vaccinated. So even more of a reason that we need to get the eligible population vaccinated. This is how to make an appointment. As most of you have heard, our DHSS website is currently down. The new website that's has some functionality is the covid19.alaska.gov. So they've transitioned it from COVIDVax to covid19.alaska.gov. There's also a toll-free number, local number. There's translator services. There's also transportation services in some of the major metropolitan areas to help people. So this is our Sleeves Up for Summer. Most of you are partnering with us on this or helping in different ways. And this is just trying to work this month to really increase our vaccination rates across the state. So I'm going to stop sharing this so we can leave a little bit of time for question and answer, which is really the fun part and where we can share information and figure out how we can support you.
Thank you so much to both of you. We're so grateful for your expertise and for sharing your wisdom with all of us. I have been collecting questions off the chat bar. So you guys can decide who wants to answer them. So really just taking them in the order that they're coming through here, which is, so the first is, does the 40% of Alaskans statistic that you cited earlier, does the 40% of Alaskans with at least one shot include the new group of children aged 12 to 15, or is that a statistic from when we were just vaccinating adults?
Lori, that is a great point, and that does not include the 12 to 15 because that data is just coming in right now. So great point.
Okay, great. So that 40% was for the eligible adults 18 and over. Okay, great. Thank you. And hopefully then, but you'll be updating that with the new data, I assume, after we get more kids vaccinated. Proud to say my daughter was one of those first in line, and we're feeling super excited about that. Is there a threshold of vaccinated individuals that will allow a business to go maskless for everyone? Like 80%, so kind of a herd immunity question, I guess, in the workplace. The question goes on, is it 80% vaccinated means nobody needs to wear a mask, for example? So I guess the question really is kind of, does the herd immunity theory work in a workplace?
Yeah, so this is Joe McLaughlin. Maybe I can start with that. And the bottom line is it's really going to depend on the situation and, you know, how congregated are workers in that situation. It'll depend also on the local incidence of disease. So we know that certain communities are still in the red zone right now. For example, Anchorage is still in the red zone. The numbers are coming down pretty precipitously. But where you have communities that are in the yellow zone, they're the low incidence communities. I think that you know, it would be a lot easier, I think, for many businesses to say that we can safely go without masks. But again, it depends on the situation and the employees that you have there at your facility. I can tell you what I'm doing here. In the section of epidemiology, we have, gosh, a little over 90 employees here now with COVID. And what we've said is masks are recommended, but they're not required. We still recommend them in congregate areas, so places where people are congregating or walking in hallways, things like that. And then in front of the door then, or on the door, people can put a sign saying, please mask before entering if they want. And that's up to them. So it's not a requirement to mask, but it is a strong recommendation at this point. And then our thinking is that as the case counts start to fall, once we go from the red zone down into the orange and then the yellow, we'll revisit that guidance. So that's kind of the way we're approaching it right now. But again, every work environment is going to be a little bit different.
Excellent. Thank you so much. While I'm asking questions, if one of you could also just put the new website that is not down in the chat bar as a resource, that would be great. I think most of us read in the paper, your website is down. The website has been compromised, and so I'm sure you'll update us all when that's back up and running. But in the meantime, if you could put the new, thank you, Sarah, for that. Next question is, since children under 12 are not cleared to receive a vaccine, how can we be confident that we can go maskless and not pass the virus on to our children?
Lisa, do you want, I can start, or if you want to start, either way. Yeah, I'll go ahead. Yeah, so the bottom line is you can't be assured of that. And so what CDC is saying is if you are not vaccinated, which includes kids under 12, then the recommendation is when they're congregating together for them to be wearing masks. And so that is the CDC recommendation right now. And that's kind of the safest way to assure that you're preventing transmission among kids. We know that disease severity tends to be milder in kids, but not always. We've had over 300 deaths, COVID deaths in children in the United States. And as I mentioned earlier, we've got issues like MIS-C, multi-inflammatory syndrome in children, which can affect children who even had mild or asymptomatic illness from COVID, and they can develop this multiple inflammatory syndrome. And then there are also long-term effects of COVID that can impact children as well. So it's important to make sure we're doing what we can to keep children safe. You know, another analogy we like to use is like, what do the muskoxen do in Alaska? What they do is when there's a threat, when there are wolves coming, they will circle around the youth, the young ones. And so they'll have a circle of adults that are protecting the youth. And so what is our circle of adults? It's vaccinated adults. So that's why it's really important to get as many adults and as many people who are eligible vaccinated as we possibly can. Again, these vaccines are remarkably safe and remarkably effective. Early on, we were kind of hoping that the vaccines would be at least 50% effective. And for the mRNAs, at least we've got 95% effectiveness, which is just quite remarkable. And again, the safety profile is excellent as well.
Thank you. I know we're going to run out of time with you. We've got a good number of questions here.
I can stay a little bit late. So
okay, perfect. All right. Well, we'll keep going. Then you tell me when we need to stop, and okay. We will make sure we get other people's questions answered more directly and post some good Q&A on our website as well. So the data that's being presented to the public, has it been peer reviewed? And like, for example, the pregnancy and breastfeeding results that you shared, are those peer reviewed data points? Dr.
Yeah, those are all peer reviewed, and it's amazing how much data is coming out. That pregnancy data I was speaking about, antibody response, is out of Mass General, collaborated with MIT and Harvard, and that was published on JAMA Pediatrics. And so we definitely have lots of new information coming out. We're very careful to look at peer-reviewed articles. We review them carefully because there's information coming in from all around the world currently.
Excellent. What do we know about vaccinated people being able to infect unvaccinated people? I think you've covered this, but I'll just give you an open moment to just share any other thoughts you have about that risk factor of passing on the virus, even if you're vaccinated.
Yeah, thank you for that question. So here's what we know. We know that a subset of people who are fully vaccinated are still susceptible to SARS-CoV-2 infection. It's a small subset. It's probably less than 10%. Or around there, 10% or fewer, with the mRNA vaccines in particular. And the Johnson & Johnson, it's probably a little bit more. But what we're seeing among those people who do have what we call breakthrough infections, so they're fully vaccinated, but they still get infected, we're seeing lower viral levels or viral titers. So the concentration of, lower viral load is the better way of putting it. So let's say somebody who has not been vaccinated gets infected, in their average viral load, the amount of virus that they're actually secreting in their respiratory secretions is here. What we're seeing for people who are fully vaccinated who get breakthrough infection is it's about cut in half. So that means that it's more difficult for them to transmit the virus to others, but it still is certainly possible. And that's why anybody who is fully vaccinated who has any signs or symptoms of COVID, we want to make sure that they get tested and go into isolation for that 10-day period so that we can minimize transmission to others.
Excellent, thank you. So this is more a question around kind of some technical assistance support. The question is, since there are so many variables, is there a place that businesses and or nonprofits can go to get advice to understand how to best keep their staff safe? I know we're gonna keep offering sessions like this, but is the task force standing up kind of an on-call TA for people who have questions around how to figure out the rules in their businesses? Dr. Rabinowitz?
Yeah, so probably the best resources, the CDC has an excellent website that does do some specific workplace guidance. The state website, when it's operational, is also an excellent resource. And then we do have an information line that people can call and get questions. And we have a bank of people answering those. And if they don't know the answers, they'll come to Dr. McLaughlin or myself for more complicated questions. So the state is here to support however we can. And we'll definitely leave our emails in the chat, so people are welcome to reach out to us anytime.
Awesome. And I can see Dr. McLaughlin also putting resources in the chat bar as well. So thank you for that. And we've got those CDC guidance on our COVID page, but we'll add these other pieces as well. So when we'll add that those resources to our site as well. Thanks for that. Got time for 2 more? We'll try. A question about food at events. So this idea of that we're all taking our masks off when we're eating. Can you speak a little bit more to the risk factors of not wearing our masks if we ourselves are holding events, or just in general kind of being out in the world?
Sure. Yeah, I can start with that one. If you're fully vaccinated, you don't need to wear a mask, even in that type of a situation. And especially we were talking about outdoor situations, that's even much lower risk of transmission. So if you're fully vaccinated, wearing a mask is not necessary. If you're not vaccinated, we still do, CDC still does recommend wearing masks when you're in settings where you're intermixing with other people who could be potentially infected outside of your household or your small bubble. And so eating is always a tricky one. CDC does have, I think, kind of a neat infographic, and let me see if I can pull this up. Here we go. If you could let me share my screen, I'll pull this.
You should be able to share your screen. If you can't, let us know. There you go.
You see that okay?
Yep.
All right. And I can try and make it a little bit larger here. Okay. So this is an infographic from CDC, choosing safer activities. So if you're unvaccinated here on the left-hand column, and then the far right-hand column, fully vaccinated people, you can see that all these examples of activities, outdoor and indoor, for fully vaccinated people, none of those people have masks on. But if you go to the left here, unvaccinated people, here's where you've got masks. So in outdoor activities, you start seeing CDC recommending masks for unvaccinated people if you're attending a small outdoor gathering with fully vaccinated and unvaccinated people, or dining at an outdoor restaurant with friends from multiple households, and then attending crowded outdoor events, and then everything indoor, going to a barber, hair salon, shopping center, things like that. CDC recommends masks in all those situations. And we can provide the link to that in the website. It's a little tricky, right? When you're eating, how do you do the eating and the masking? You just kind of have to figure it out, I guess. But really just know that that's a potential risk for transmission. Again, it comes down to time. How much time and proximity. How much time are you spending with people in close proximity? And it's also a numbers game. How many people are at the event and things like that. If it's outdoors, we know the risk of transmission is much lower than indoors, but it's still not zero. If you and I are 3 feet apart outside and I'm spraying, when I'm talking, I'm potentially transmitting the virus to you.
Thank you. Okay, last question before we lose you today. If by some miracle Alaska reaches what ends up being considered herd immunity, which is what we say we're all looking for, how concerned do we need to be with the rest of the nation and our international communities who have not reached the same percentage of vaccinated people? And this person says that's coming from a perspective of an organization that deals heavily in tourism, and certainly our Canadian partners to just on our other side of our border, I think has been a good concern. And I know the governor has tried to address that a touch, but could you speak to that idea of, Alaska might get there, but what about everybody else?
Yeah, thanks for that. And then I'll leave all the rest of the questions to Lisa. Sorry, Lisa. Yeah, so that is a really important point. And we need to think globally about this pandemic. Even if we were to reach herd immunity in a few states in the nation, or the nation as a whole, or in Alaska, which it's seeming less likely right now that the nation as a whole will reach herd immunity anytime soon. But if our immunization coverage rates are going up, and they will continue to go up, I hope, over time. But we know that with respect to the SARS-CoV-2 virus, it mutates, right? And it doesn't mutate as frequently as the influenza virus, probably about a third as frequently, but it mutates a lot. It's an RNA virus. And the more human beings that are infected with this virus, the more opportunities for mutation. And as we see more mutations, we are going to see new variants emerge. Some are what CDC is considering their lowest bar is the variants of interest, and then variants of concern. And then the highest bar is, I can't remember what they call it, but I kind of think of it as a variant of worry. So we may see some variants emerge that are not only have increased transmissibility, increased virulence, but also potential increased resistance, if you will, to prior immunity. So those are the things that concern us. Fortunately, with these mRNA vaccines, the technology is such that we can very quickly pivot, because it's basically just mimicking the genetics of that spike protein. And as that modifies, then we can modify and create a booster dose, which will take some time, but not a ton of time. So it is a concern. Also, people coming into the state from the lower 48 or from other countries, there's always the risk of importation. Certainly, we're going to continue to see importation events occur throughout this summer and probably in the years ahead. I mean, SARS-CoV-2 virus is going to be with us for years. And so we, the hope is that we will have enough vaccine available for all countries to be able to vaccinate their citizens in the months and years ahead.
Thank you, Dr. McLaughlin, for joining us. We're so wonderful that you could be with us today. That is the extent of the questions I think we have at this moment. We have another legal question that we'll defer to Mr. Mahoney and let him offer the legal advice. So we appreciate you being with us today. Dr. Rabinowitz, thank you as well. We're so grateful that you could also join us, especially at the last moment. So thank you. Any final words from either of you, just words of wisdom you want to share with us in addition to what you've already shared?
No, just keep up all the good work that you're doing, and just know that we're here to support you. So please reach out if you need anything, or if you find areas that we need to collaborate or further education. I did put a link in there. If people want to request, we have a group of healthcare professionals that are happy to go in and do vaccine education. Again, like you said, not pressuring people to get vaccines, just getting the science and the information out there. So we thank you greatly for having us.
Wonderful. Thank you so much. Wonderful. We're going to pivot now to what it looks like in the workplace. Thank you so much. We have two of our next guests joining us, Rebecca Savitas and Steve Mahoney. Rebecca is going to take us from an HR perspective, talking with us about employees and volunteers and participants in our work. And then Steve will handle the legal questions that come alongside of that. We've asked Rebecca to take the lead just to give us a framework for the conversation. Again, please note your questions in the chat bar. We have some questions that we got in advance. They were mostly focused on first Rebecca and Steve, so we'll turn to those, but I'll take more questions as we go. Rebecca, with that, it's your stage.
And it helps if I get myself off mute to have that stage. So the good doctors are a tough act to follow. But as we transition to Steve and I fielding some questions, and we will take a tag team approach to do that, as Lori said, I want to set the stage. And one thing I will say is that one thing that we know our sector does really well is we adapt. And this is something that we've demonstrated time and again over the past year. And our plans to return to the office and in-person interaction safely are going to require that same level of flexibility as the COVID landscape continues to evolve. And in the past year, each of you have continued to serve our communities through adjustments in how and where we perform the work. And some of those adjustments we know were minor, and some were quite major. And some of those shifts are temporary, and others we might want to adopt as a part of our new way of being. So as I've thought about this, I think of it, these key factors that I think of as a three-legged stool that doesn't always sit steady. And those three key factors that I want you to consider as we go through our conversation today and then decisions you make for your organization. The first is safety. And we covered a lot of that with the doctors just a moment ago. And this just isn't just your safety, but it's also the safety of the general public. The other leg of this three-legged stool is employment laws. And the laws may seem fairly black and white, but as soon as we put a human being into the mix, it can get very gray very quickly. And the last of the legs of this three-legged stool is that of an organizational culture. And this is something that varies from one organization to another organization. And the strategies for returning to work or reopening your office space are not going to be a one-size-fits-all. Dr. McLaughlin shared what they're doing in their workspace. That might be something that works for you, and it may be something that would not work well for you and your staff. But as anticipation grows, and sometimes that is good anticipation or bad anticipation, we want you to be safe, not just for yourself, but your teams and those you serve. It was just about a year ago that 4acre was doing this webinar series for rapid relief in response to the pandemic. And over the past year, we said it then, and we've continued to say it over the past year, is that we have been building the car while we have been driving it at 100 miles an hour. And although a year later, 12 plus months later, we may have a tighter grip on the steering wheel, the same is true of developing strategies for returning to and reopening our workspace. So in just a moment, Steve Mahoney and I will open the floor for a Q&A tag team for the organizational legs of the stool as well as the legal leg of the stool. One thing I will stress is that we are not providing legal advice, yet we are offering things for you to consider as you develop those strategies for reopening your physical workspaces. And Lori will continue to be our moderator, and her job is to make us sound more intelligent and better looking. So no pressure, Lori. With that, I'll let you take it away.
All right, well, great, thanks, Rebecca. So, I think just to reiterate, right, when in doubt, we invite you to, talk with your own attorney. We're gonna do our best to give you, some of you are asking just straight up legal questions. We're gonna give you our best thinking at this moment, and we'll ask you to run that back through your own policies, your own board, and to make the right decisions for you. So I'm going to actually start with the questions that we received in advance, and then we'll work our way through to the questions on the chat bar. And so, straight out of the gate, can we ask our employees if they have been vaccinated? Can we ask our volunteers if they have been vaccinated? So can we? And I think this, Mr. Mahoney, that this is a legal question, but Rebecca, this is also a culture question. So please tag team in both of those ways. Can we ask?
All right. I was going to ask or wait for Steve to take himself off mute, but maybe I'll lead out. And Steve, you can kick me under the Zoom room table if I get it wrong. The answer to the question is, can we ask? The answer is yes. From an employment perspective, what I would say is let the question stop there. Avoid the temptation to have a follow-up question about why an individual is not being vaccinated. And the reason for that is we don't want to violate a couple of little laws. Americans with Disabilities Act, Title VII of the Civil Rights Act, and Genetic Information Non-Discrimination Act. And so what I would encourage you to do is if you ask the question, are you vaccinated? Let it stop there. Invite employees, if they are not vaccinated, to seek out, maybe it's the executive director, or if you have an HR team to seek out a conversation with them so you can navigate a interactive process to make any appropriate accommodations. Steve, I thought I heard you chime in, so I will stop now.
No, I was just going to say, without providing legal advice, legal scholars, and I'm repeating others' advice, are a little mixed on whether you can, but essentially you can ask, provided, and I agree with Rebecca 110%, you need to be very careful not to ask, how are you doing? Did you get vaccinated? Or are you well? Did you get vaccinated? Or how did the vaccination go? Those are essentially medical type questions. Health questions are not permissible. So yes, you are permitted to say, are you vaccinated? But that's the end of the story. And I would ask the question, I don't need to know anything else about your medical history, but are you vaccinated? Would be the way to ask.
And would that line of questioning hold true for both employees, consultants, volunteers? Or are you just speaking now to an employment situation?
It would hold across the board to all. The employee is the one that you have the most potential liability related to, but a consultant who is not necessarily hired or is currently on contract could also state that you are asking illegal questions regarding their health that may impact their employment. So it would go across the board to everyone.
Okay, great, thank you. Would you recommend, this is not a question there, but I'll just do a follow on there. Would you recommend that being a policy or a practice of asking that question? So how formal would you make that line of questioning?
I would suggest that if you're going to ask one person, you better be prepared to ask everyone, because asking one person essentially may create a discriminatory analysis or a discriminatory complaint that you singled out someone and you don't know if they're a protected class or have medical issues or religious issues that they may not be necessarily comfortable with and don't want to share, and they don't have to. So it should be a policy. If it's a policy, it should be written down so that it's followed, and it should be followed. If it's not followed, there could be consequences. Okay. Rebecca can speak to that as an HR rep.
Yeah, I will add to that is if you have it as a formal policy, standalone policy or procedure or a guideline, that you not only follow it, but take the step to train supervisors, right? The individuals who spend more time with employees than you likely do. Train them not to ask that follow-up question of why didn't you get vaccination or vaccinated, or how did you fare after you got your second shot? And if an employee volunteers, I'm opting not to get vaccinated because I have a religious belief or I have a pre-existing medical condition, train your staff to direct that individual to the person who is responsible for human resources within your organization. If you're a larger organization, you might have a department. If you're a smaller organization, you may be HR not by title, but by function. So take that extra step to make sure that you are training your supervisors in how they interact with their staff on that question.
Excellent. Okay, we're going to pivot a little bit. It says, what considerations do you think are most important to address in a post-COVID work from home policy? Thinking especially about organizations who have staff who are direct service providers that may be less flexible in their working from home options, and others who have more flexibility, maybe some admin type staff. So kind of what are we thinking about right now in this hybrid work world? I think Rebecca, you might want to start there.
Yeah, I'll start and then I'll leave it to Steve to do the hard part. So there are a variety of factors I think employers should be considering, whether you have staff that are continuing to work from home or on-site somewhere else outside of your office, or even a hybrid approach. And that is, you want to think about the safety. Remember, that's one of the legs of this three-legged stool. Employee engagement, especially if we have a hybrid approach. We have people who will be present in person and others who will not for a variety of reasons. And not just their engagement, but their performance. We want to make sure that we're paying attention to the law, our organizational culture, And we're not focused just on the outcomes or the output, but we're also focused on the outcome. The other things that I would encourage you to think about is the work-life balance, especially if we have individuals who are continuing to work from home, maybe because they have children that are school-aged, that are not going back to school, or maybe they are the caregivers of aging parents. And so they're wearing multiple hats, right? Many of us continue to wear those multiple hats. And so there may be some flexibility of scheduling that you need to continue past the time you're reopening your workspace. And then equity is another big piece that you should be paying attention to, right? We know that women are leaving the workforce out of necessity. What does that mean from an equitable space? Are we providing an equitable landscape for all of our staff, whether they are in person and we see them every day, or if we only see them in a Zoom room? So that's my general recommendations, and then I'll leave it to Steve to talk about those organizations that maybe have direct service providers.
Yeah, again, without providing legal advice, Rebecca brings up a very interesting issue with unintended results, especially unintended discrimination, where you might look at an individual and say, wow, that's a mother taking care of children, or that is a father who's taking care of children, and they are placed at home, and they are placed essentially in a discriminatory environment for being promoted, for being oversighted, for annual reviews. You want to be careful of that in what you do. Equity is a very important issue there, because if you don't have a policy on why someone can stay home, other people who are told they can't stay home, you may have a discrimination issue there that you need to be careful of. So again, policy with a clear distinction of why and why not is very important. You might consider, however, that someone who is unable to be vaccinated or unwilling because of a belief, working at home may be a necessary accommodation. So under the ADA rules, the opportunity to work at home if they can and get their job done may offer an accommodation for what otherwise would be a work situation in your offices. The last you need to think about is talk to your insurance advisor. When someone is working at home and they trip over a cord or a carpet, or their computer falls on someone, they could very well be in a workman's compensation insurance issue, because they are then working in an environment that the employer has approved. A lot of that is overlooked in an emergency situation like we had in the last year, but as it becomes common practice and policy, that won't be the case. If you're an off-site worker who normally works off-site and you leave from your home to visit someone in a work environment, from the minute you get in the car, the company is liable for what happens with that vehicle. So you need to be very careful that, again, unintended consequences. If someone is working from home and they go to work process from home, they are not in a commute. They are working, they are driving while at work, which means the employer may be subject to whatever liability occurs from that driving. So having an understanding and simple things. Is somebody going to get carpal tunnel syndrome because their office is not set up correctly? Guess what? That's the employer's problem, not theirs. So there's all kinds of ergonomic and other issues that you normally wouldn't consider because your office space is regularly reviewed and analyzed. Those would be the biggies to me.
Thanks, Steve. While we're on that topic, I'll just speak. So we're going to get into kind of masking and unmasking scenarios here. So can we just speak kind of broadly at this moment to, what could we regulate or have policy around in terms of our workplace ourselves around masking? And for those of us that work, I know at Foraker, we spend a lot of time in people's homes doing those strategic planning sessions in people's living rooms and offsite in other people's boardrooms. And I know we're not alone in our flying on airplanes and doing all the things that we do to make our mission work. It's one thing for me to regulate 4-acre office space. It's another thing to have a conversation about what it looks like for our staff to be working in other spaces. So Steve, if you could address first that, and then Rebecca will talk with you about what can we control and not control around the masking issue?
Well, in terms of masking and vaccination, can you require masking? Absolutely, positively you can. If someone might have respiratory issues or something, again, you might have to consider accommodation, and the policy should provide for accommodation. But I'm aware of, there's no religious problem with wearing a mask. However, I don't know every religion and I don't know every belief. That should also be taken into consideration. But yes, you can absolutely demand masking, including people walking in off the street, contractors, volunteers, and employees. Vaccinations is that's a little more controversial. Yes, you can demand vaccinations, but you have to have a reason to do that. It has to be for the health and safety of the people around you, and it has to be above a level that would be a standard hurdle. This is something that you're really concerned with. Not that someone gets a sniffles or gets a cold, but that someone could pass away. It's a balancing test. So again, you have to be cautious here. You can't force someone who has a religious problem or has a medical condition to get a vaccination. If someone doesn't want a vaccination, the bigger issue, and I'll let Rebecca handle this, but Delta Airlines went through a process where they reviewed what they were going to do. They require all new employees to have a vaccination or they are ineligible for employment. There's an ADA issue there and they deal with that separately, but that is their rule. They did not, however, do that for current employees. They took an independent poll. They had a survey done. 28% of the employees said they would resign if they were forced to vaccinate. So that's the HR side of this, and I'll let Rebecca handle that.
Thanks, Steve.
Yeah, so from an organizational culture piece, right, we can throw around words like mandatory or mandated when it comes to vaccinations or mandatory return to work or to the physical space. And for some organizations, that might be part and fit well with their organizational culture. Most organizations, it doesn't fit well. And so as employers, you're left navigating, right? What do you do for your current employees? If we're looking at the Delta example, what do you do for the current employees? And what do you do for incoming employees? Now, certainly they seem to have taken the approach where they will say it is a term and condition of employment for all new hires and future hires. And what I would say is whether you determine as an organization that you're going to mandate or require mandatory vaccination or do something different, what I would encourage you to do is to gut check that with your legal counsel, right? To understand what your risk is if we do this, then we have this level of risk and you're accepting that risk with your eyes open. Okay, so there's certainly the approach that Delta seems to have taken. One of the rules of thumb that I would encourage you to think about just in general for human resources is consistency, consistency, consistency. So please consistently apply the policies across the board with your staff. And this goes back to making sure that your supervisors are trained to consistently apply the policies. So if you create a COVID policy or a COVID procedure or guidelines, that those are consistently followed. Now, that doesn't mean you can't deviate from that policy, but again, this is a calculated risk that you take. But if you deviate from your policy, what I want you to consider is, would you be willing to do the same thing for another individual in the same or similar circumstance? And if I do for one, I better be prepared to do for all. So a lot of what we're talking about and a lot of what you're going to encounter, you'll need to navigate on a case-by-case basis. For example, if somebody says to you, I have a religious belief that I don't get vaccinated, well, that's something that you would likely walk shoulder to shoulder with your attorney through that process. What does an accommodation look like, right? And when we talk about an accommodation, whether it's for an accommodation under the Americans with Disabilities Act or an accommodation for a seriously held religious belief, that accommodation isn't a one-size-fits-all. Right, so again, case-by-case basis.
Yeah, one thing I'd like to add too.
Go ahead, Steve. No, go ahead.
One thing I'd like to add too is that the vast majority of companies are not mandating. They're using a carrot stick kind of situation, and they're offering carrots, time off, pay, all kinds of different incentives, because there are significant risks here of a policy that isn't 100% enforced and people taking issue with that and creating liability. So the vast majority of companies are using a carrot approach rather than a stick approach.
And we could be like Ohio and offer $1 million lottery, right? So there's all sorts of carrots going on out there. So I just want to clarify this because I think this is a question that I'm seeing kind of woven throughout a number of other questions, which is, so let's take the municipality of Anchorage, where the three of us are currently sitting at the moment, lifted its mask mandate, but not entirely clear how to process that moment, because it's only for vaccinated people, but most of us have no ability to actually make people prove that they're vaccinated. I'll just ask this as a straight up question, can an organization have a different rule around masking than the rule of the local government or the state government? Can an independent organization, nonprofit organization, create their own safety rules around masking?
So I have an initial thought on that, and then Steve, please chime in or correct me if I'm wrong. But even with the CDC lessening and loosening its masking guidelines, right, which gives a lot of people hope, which is a wonderful thing to have these days, it doesn't mean that there aren't different state, local, and tribal requirements for masking that may be put into place. And businesses can also say, we're requesting or requiring individuals who visit our space to wear masks. So that's a CDC. The one thing from an employer perspective I want to be mindful of is that we have this little thing called OSHA. And OSHA, really the only statement that they have made on the lessening or loosening of those CDC masking guidelines is that we're reviewing it, right? And so the OSHA is the Occupational Safety and Health Act. And so we want to make sure that we're not just focusing on the good news that the CDC is providing with the lessening of loosening of the mask guidelines, but we want to make sure that when we do have information from OSHA, that we are following those requirements and guidelines as well.
Steve?
Yeah, I mean, realistically, you can have any rule that's greater than the rule of law. So if the local jurisdiction says you must wear masks, then you must wear masks. You can do greater that and say you have to be vaccinated or something else, stand 15 feet away. In relation to that, you can make your own rules, but they cannot be less than the jurisdiction. So the local jurisdiction, you have to follow. If the state is more, you have to follow it. If the feds are more, you have to follow it. Same with tribal. Tribal, it's the local tribal entity and then the federal government on top. But in essence, you need to be careful of that because they set the rules and they set the law. You can ask for more, but you can't require less.
Okay. You can ask for more, but you can't require less. That's our take home for today. All right. So, that's a COVID t-shirt for sure. So let's turn our attention a little bit to some of the activities that we provide here. So there's a set of conversations about kind of the events that we put on. And we've been mostly focusing so far on employees and our workplaces. So let's turn to an event. Can we legally ask people in an event to be vaccinated? And if we can say you must be vaccinated in order to attend this event, can we then turn people away who cannot prove that they're vaccinated? Two-part question.
I'll take it to start. Yes, someone who comes to your event is a voluntary participant, and you are voluntarily allowing them in or not, and you can make the rules. So if you want to require vaccination, that's fine. If you want to require that they bring their card with them that proves the vaccination, as long as you don't ask for more and that card isn't part of a full medical file, it's just the card, you can request that. So yes, you can mandate it, and yes, you can enforce it. Again, it's more a political issue than it is one of legality. You may do it with a capital M.
Steve, I know you and I spoke recently about kind of a hybrid of that answer, which is you can, yes, you can, and you could also say you must be vaccinated or you must prove a negative COVID test. So I think some people are trying to find that middle ground of accommodation, if you will, but not accommodation with a capital A, but just a way to navigate that conversation.
Right. Again, you have great flexibility in what your rules are, but And again, I think this is more of a Rebecca question, but you need the balance. If you're putting people shoulder to shoulder in a room and there's that many people in a room, you have to ask yourself, are you going to be responsible if someone goes in that room and they're infected and start to infect people around them? Was that your liability? And I can guarantee you there are lawyers out there that will ask the court to determine it is your liability. So that's part of the protection. But you can say masks, you can set seats 6 feet apart, you can require vaccination or a negative test within 72 hours and this kind of test. But yes, you can set those rules for yourself, and a participant does not have a right to participate otherwise. Again, you might have to deal with some ADA accommodation issues, even in a voluntary participation circumstance. But that's likely a part of whatever permit you have for the event or the event locale having its own rules. So you need to be cautious there.
Rebecca?
Yeah, I would echo, erring on the side of caution, I think would probably be the most judicious approach in not just this situation, but in other situations that you'll encounter. Because even though they may or may not have a case, right, somebody can file a COVID claim essentially against you. And so you'd want to be able to demonstrate that as an employer, as a host of this event, we took all of these steps to mitigate the risk, right? Whether it was the social distancing or masking, or looking at a negative COVID test, or the COVID or the vaccination card. But you also may consider options that are not necessarily about proving you're vaccinated, but are you doing temperature screenings, right? So I would look at it as outside looking in. If a situation were to occur or an event were to occur, and that there was a COVID case or cases that came out of that, would I be able to stand flat-footed in front of a judge? Or even worse, if it played out on Facebook, right? Would I feel comfortable that we did all that we could to mitigate the risk?
Thanks, Rebecca. I think a number of questions kind of in the proving category here to both of you. So a couple of questions here. How does one go about proving a religious exemption? And I assume that means employee to employer, but maybe broader than that.
I will take the legal side of this without giving legal advice. You don't ask someone necessarily when they say they're not vaccinated. That would be something that you approach your HR person with, who there is some delicacy in that discussion. Proof with regard to religious belief, I don't know how to spell the word proof in that relationship. A person does not have to prove their belief. They have to believe in what they believe in. So I'll push it to Rebecca, because this is one of those soft issues that's more HR than it is legal. All I say is you can't ask why.
And this is one of those times, Steve, if the question came to me, you would be my first phone call, right? Because there's not necessarily a straight line in this. And where Steve may not be able to spell proof, right? We may not be able to consistently spell the word belief from employee to employee, right? And perception as far as religious belief is different from each individual. And so you may have somebody that their version of religious belief is that you are in church on a specific day once a week, and that you do this long list of things. And for others, it may not be about attendance at all, right? And so that is a conversation that I would be navigating shoulder to shoulder with my attorney. And for me, that is one of the things that is at the top of that case-by-case basis.
Excellent, thanks. Another variation on the proving, can we, about medical exceptions. And so I think you're going to say something similar, because now we're in the ADA compliance place, but go ahead and just address that for clarity if you can. So proving a medical exemption.
Yeah, and just with ADA, for those of you who aren't aware, it applies to organizations with 15 or more employees. And certainly, as Steve has said, you can go above and beyond what the law requires. You can't do under what the law requires. But under ADA, it says that we don't discriminate against individuals who are qualified to perform the essential functions, and that's the guts of why the job exists, with or without a reasonable accommodation. And again, it's not a one size fits all. So if someone asks you for a medical accommodation, it is a rare day that you will resolve that request in that same setting, right? Because you may get a behavioral health provider involved. You may get a physician involved. You may have legal counsel. And what you're engaging in is an interactive dialogue, right? And so where it's not a one size fits all, it's also not a one and done conversation. So the accommodation that's requested may not be the accommodation that is provided, and that accommodation may evolve over time. So there may be a situation where somebody has an existing medical condition that currently they are not able to get a vaccination. And so the accommodation that might be made for them is that they continue to work from home and they're able to mitigate their exposure to the virus. But maybe their health hopefully would improve, but maybe their health status changes. And we need to make sure that that accommodation still works. So again, case by case, and it's not something you're likely to resolve in that same setting. And then Steve, if you want to chime in with anything else.
No, I was, the only thing I would say is with a medical accommodation, to the extent in relation to privacy, that the purpose or reason for the medical accommodation can be maintained in privacy. You can ask someone what is generally their medical condition that prohibits them from the vaccination. But that has to be in a private setting, and it has to be someone, normally if it's an HR person, they'll take it off the supervisor's shoulders, because the supervisor may be proven to have somehow been impacted by that knowledge and impacted the employment of the individual, and that's what you're trying to prevent. So again, that's a soft issue. You'd likely call your attorney and work with your HR rep.
Thanks to you both. Steve, you, in your earlier comments around hybrid work or home-based work, you triggered a couple of additional questions. I'll come back to that. Can an employer inspect a home office for safety issues?
They certainly can. The accommodation that is provided by allowing someone to work at home is an accommodation that is a voluntary accommodation in most instances, and therefore the safety of the employee, the safety of your equipment, the overall, I'll say, financial condition of the company in relation to insurance, yes, they can. Now, can they demand to go in somebody's house? No, but if they're not allowed to go into someone's house, they can change the accommodation and say, therefore, you can't work there. Go find yourself an office space that you would rent, or whatever else might be another accommodation. But yes, you can ask for it and demand it, so to speak, but they don't have to comply, and there are ramifications to not complying. Rebecca, any thoughts?
The other thing that I would add to that is it's not just the safety of the workplace, but it's also the safety of the work product. So if you're dealing with confidential information, setting out that expectation that the employee working from home would not have that information available out in the open to a roommate or to a passersby. And you may engage in a process with them that asks them to attest to the security of all of those things that both Steve and I have mentioned if they are not allowing you in their home. So there could be a couple of different ways around it.
Also, Steve, you mentioned the liability of people driving while on work time. If an employee is driving from the office to a work-related meeting, we just make an assumption that that liability is in play. Is that correct?
Yes, your auto insurer should know that your employees go from the offices to see clients.
Great, thank you. Okay, we are getting, since we're on the liability question, in the emergency declaration that the state passed and then undid, and in there was a piece of a ruling around employee protection from litigation. Could you tell us where that stands, Steve, and what where we are, just kind of an overall blanket coverage for businesses and nonprofits?
In the state of Alaska, there was a House and a Senate bill. Both of them are stuck in committee. So we don't have a statutory fix for that. But I think right now there's 47 states that have active legislative actions on employer non-liability and employee issues with regard to rights with regard to this. Because remember, just like the Spanish flu lasted 3 years. It went through 3 iterations and then it was gone, and it's been gone ever since. Hopefully, this will do the same thing. We'll see ourselves getting supplemental shots, likely, 6 months to a year after the first vaccination. Is this going to be a forever thing, or is this for a few years? And if so, how does this impact our policies in the future? So there are a lot of things that are going on here.
Okay, thanks. Just watching our clock here, we got a lot more questions. So just so you know, if we don't get to your question in this round, which I just really appreciate all of you asking your questions, clearly lots of interest here. We are tracking who's asking them. We will follow up with you directly. If we feel like that we can summarize it quickly, we'll put it in a Q&A that we'll post on the COVID page as well as a reference point, and we'll put them in groupings so you can find your answers a little more quickly around whether it's masking or vaccines or just general policies around remote work, which seems to be kind of the 3 big buckets that we're circling around today. Before we have to end here, I'll just maybe just focus a little bit more on just helping our employees. I mean, we really, I think all of us are trying to create a positive workplace culture where our employees, consultants, and volunteers feel safe. And I'll just invite Rebecca and Steve for you to just reflect on what kinds of frameworks and things could we be putting in place? What kinds of questions could we ask or not ask? We have lots of people who are doing employee surveys around, what does safety feel like and look like? Just give you a little bit of open space to just reflect on what you're seeing out there that you think is actually helping create a safer, more positive environment for all of our employees, whether they're vaccinated or not, whether you have a mask policy or not. Just a little bit of a framework around culture would be great. Rebecca, do you want to start?
Sure. And before I forget, I'm going to put some links in the chat box for resources for everyone. But when you think about that organizational culture piece, I think that the key thing to remember is that we are all dealing with humans, and we are humans. And we have employees who have not only navigated this as an employee, but they've navigated it as a parent, a spouse, a partner, a child, individuals who are also impacted by the virus. And there may be some grief that is taking place in that. And that may not necessarily be the grief of losing a loved one, but it could be that they have lost and had to adapt to their norm, right? What was normal once was not normal now, and we're now asking them to adapt again. So I say that, and also want to follow that up with is you are experts in your organizational culture. But what I've observed does not necessarily land well is using absolute language, right? Using absolute language of mandatory, mandate, must, always. Right, but then on the other side of that is we have that safety leg of that 3-legged stool. We want you to be safe. We want to provide an environment for our employees that's safe in a variety of factors. So for me, the balance is encouraging and an invitation. Right, we encourage you to get vaccinated if it's the right thing for you. And our invitation is that if it's not something you intend to do, please contact your HR director or your CEO to navigate what those next steps look like for you. And this is something that should be kept in confidence. So I will say in 4Acre's experience, we have a lot of open books here at 4Acre. And we announced when we were getting vaccination, right? That was something that our staff voluntarily did, but it wasn't a requirement. You publicly announce I'm getting my second shot on this date, right? rather the invitation is, if you're not getting vaccinated, please let us know. So if you have employees that have publicly announced, great, good for them. And while I would love to have people on their honor system, you still would need to have some sort of record keeping to say our staff are vaccinated, right? And this is something that is held in confidence. It is confidential medical information and would live with your HR, likely your executive director or whoever is tasked with your HR. But like, I'll go back to that, not using the absolute approach, right? The iron fist approach, and that balance of, we're working with people who have been through a lot, and we are also people who have been through a lot. What is our organizational culture in determining how do we keep people safe? How do we comply with the law? And how do we still look like us as an organization? So that's just kind of a general thought. I'll stop now, and Steve, you take it away.
I would just say that essentially every single board or management group I've sat with has their first question is, how do we make sure everybody else is safe? Not necessarily themselves, but everybody else. And so the things I've seen have been, for the most part, voluntary requests to get vaccinated, some form of swag as a gift, 2 hours off, driving there and back, making sure there's no costs involved for the people getting vaccinated. I've seen places where we put, some people have taped a mask on their door and said safe zone, meaning they're vaccinated, they're doing it voluntarily. And in their office, you don't need a mask. But at the same time, they keep masks next to their keyboards. And if someone comes in with a mask, they put on a mask out of courtesy. So I'm actually feel very good about how most people have reacted to this, which is caring for others. And to the extent I've seen policies that work, they're very clear about that. Very first line is, we want to make sure no one is injured. And this is our policy. And as Rebecca has suggested, a policy in writing that people understand is the most forceful and best policy. So I think if everybody keeps that in consideration, that's where we get the best answer.
Well, thanks to you both. The questions are just keep coming. So everyone on the call and everyone listening to this recording in the future, just know our job will be to continue to collect all of your questions. We will find a format to share the answers for everyone. It will most likely be our COVID relief page. That would be the place where we are sharing our resources. We encourage you to bookmark that place on the website. And check it often. We are trying to update it as often as we can with new information, including the answers to these questions that we did not yet get answers to. And so appreciate that. Again, the recording will be there as well, so you can hear the answers to the questions that have already been asked and answered. And the additional links and handouts that have been provided during this session will also be available. I want to thank Steve and Rebecca for making the time to be with all of us today. Keep your questions coming. We know you have lots of them. This is a very uncertain time. We are all navigating a lot of moving parts and pieces while trying to keep ourselves, our employees, our board members, our volunteers, and all of those around us safe. That is ultimately what we are all working towards. I strongly encourage you to set that tone and to celebrate safety with everyone that you're with, and help us all be a part of getting to that herd immunity. I do want to say nonprofits have been wonderful to not just work on this yourselves, but also for the people that you serve and our communities that we serve and the greater good. That's really why we're all here. There are ways to be more involved in encouraging and promoting vaccine use. And if that's right for you and the people that you serve, then I encourage you to do that. I am proud to say that I am vaccinated, and I say that often because I feel like that is part of the solution, is to talk about that freely and openly, and kind of dispel some of those myths. So you'll see 4-Acre continuing to promote those kinds of conversations based on science, and I appreciate all of you taking the time to be with us today. Tomorrow, we will be focusing on the rollout of a new website that will help nonprofits, tribes, local governments, and businesses navigate the new American Rescue Plan. I hope you'll join us tomorrow. We'll be hearing from our partner at the National Council of Nonprofits in Washington, D.C., and our Alaska partner, the Alaska Municipal League, Niels Andreessen, will come and talk about this statewide website that is available to for all of our use. 4-Acre is proudly partnering with the Small Business Development Center, the AFN and AML to make this happen, and and the Alaska State Chamber, and we're excited to roll it out to you tomorrow. I hope you'll join us for that webinar at 9 a.m. tomorrow morning. There's still room available in that session, and of course it's free and it will be recorded. Thanks again, Steve and Rebecca. Keep those questions coming, and be safe out there, everyone. We will see you at the next session. Mara, you got a chat bar for me?